No.
Greetings.
Greetings. Good evening.
I keep forgetting the time change. Welcome to our live.
Welcome.
Okay, so welcome back to our Instagram live session, Beyond Beauty. And today for episode 4, we'll be zooming in a bit on IV therapy, its benefits, uses, and everything you need to know. I'm your host, Courtney Cunningham, and joining me today is our very own Dr. Stevenson. Welcome again.
Welcome. Thank you, Dr. Stevenson.
Alrighty. So let's kick things off by addressing the basics. What exactly is IV therapy and how does it work?
So thank you for asking. I am Dr. Stevenson from Bloomer Rogers Aesthetics here in Livingston, New Jersey. And I'd like to share some valuable information today about IV therapy. So basically what IV therapy is. IV therapy is intravenous, which means through the vein. And this is infusing nutrients, vitamins, supplements into the bloodstream for numerous reasons. So most of our IV therapy is based on what our clients are looking for or what they need.
Okay. All right. I mean, that does sound fascinating. What are some of the common reasons people would seek out IV therapy?
So now that we are springing into spring, we just went back this past Sunday and we're 1 hour ahead. Now people are going to be getting out. So they want to boost their energy. They also want to decrease fatigue. They also want to bring out their inner beauty. And they also want to help hydrate themselves and also to replenish their complexion and prepare them for the new season.
Okay. Mm-hmm. So it's not just for medical purposes. Could you walk us through some of the processes of getting the IV therapy session?
Definitely. So for our infusion, the patient will come in, they'll book an appointment, they'll have an assessment, they will tell me what it is that they're concerned about. For instance, if they're no energy, if they're concerned about weight loss, if they're concerned about acne, pigmentation, anything that pretty much bothers them, that they're very athletic and they work out a lot and they find that they're just not getting enough out of their workout. And we kind of like target it to what the client wants. So they'll get the assessment. I will take their vital signs, and vital signs mean I'll take their blood pressure and their pulse. Some of the medication can affect vital signs, so that is why we take it.
Oh, okay.
And also, too, some people may be afraid of needles. So just that I can have a baseline, before and after their IV therapy, what am I looking at?
Yeah.
Okay, so that I know whether anything changed during the process. So when so after that assessment is done, their vital signs is stable. I ask them any medical history, because certain medical history can also determine which IV therapy is safe for you.
Okay.
So I was trying to find out what is the safest IV therapy based on your medical condition. So we'll start off by inserting an IV, and we have an IV kit that looks like this. It has the tourniquet in it. It has the IV needle in it, and then we have we call this the extension tubing for the IV therapy. And then we'll have our hanging bag. So that is how we prep the patient. So we'll look for an IV, and then we'll insert the IV, and then we will start our infusion. So it all depends, like I said, what they want. If they want like a Myers cocktail, we have the Myers cocktail. All of our IVs are not pre-mixed because they're based on what the patient is looking for. I think someone may have a question. We can stop and take a look. I think it's maybe on my end.
Okay.
And this person is, oh no, sorry, someone is saying hi. Okay.
Oh, hi, Blanca Bunny. Welcome to our
Hi,
live.
everybody. Yeah, I was thought it was like a question.
Okay.
So we'll start that process. So what I do is I will mix the cocktail, depending on what the client want. Our IV cocktail is come like ready made. So I'm not like taking multiple vials and putting this into into the cocktail. So if they want a Myers cocktail, everything that they need is in the Myers cocktail. So I'll just have the syringe, pull it up, mix it into IV bags, okay, and then I will infuse it into the client.
Okay.
While they're being infused, we'll give them music. They can use their iPad. We'll turn the lights down. We give them music, make them very comfortable, and just let them relax.
Okay.
From time to time, we do like peeping and check on them. Like I said, depending on which IV therapy they're getting, just to make sure that there's no issue.
Yeah. Go ahead.
So there are some IV therapy that is not a drip. So it all depends, like I said, what the client wants. Sometimes it's a quick push. So the time frame varies depending on how fast the IV infused, depending on the patient's veins. So if the patient has little tiny veins, it takes a little bit longer for the IV fluids to go in.
Right.
Because I don't put like a large gauge IV in, it's a small gauge. So it may take maybe 30 minutes, sometimes less, depending on what the client is looking for.
Okay. So two different clients could come in and get the same treatment, but it administers differently.
Exactly.
Okay. That sounds like, it's convenient and an efficient way to get essential nutrients into our systems. Are there any risks, though, or side effects associated with IV therapy?
There's always risk. With everything in medicine, I would love to say there's no risk. As I had mentioned before, they can have like a tachycardia, which means their heart rate may speed up. Their blood pressure may be elevated. Their blood pressure may drop. They may flush. So there's many side effects, and that is why we ask them these questions in the consultation before we get started, just so that I can know what to be looking for while they're IV infused. Obviously, anytime you break someone's skin, there's a risk of infection. There's some people who may not have any veins, so it may take a little bit longer to find an IV. So there's a lot of issues that can go into it, but overall, it's a nice and pleasant process.
Yeah, and I guess once the client is open and honest about their health background and stuff, everything should go perfectly fine.
Well, as I always say, I never say perfect. Everything will go nice and smooth.
All right, playing it safe. All right,
make it safe. Yes.
All right, so now let's talk about the different types of IV therapy available. What are some of the popular options and what benefits do they each offer?
So we have numerous, as I explained to you. So the Myers cocktail is our number one cocktail that most clients ask for, the Myers cocktail. And this is more for someone who is athletic. They run, they exercise a lot. They may find themselves that they're getting fatigue a lot, or overall they want to boost the immune system. So the Myers cocktail is like your catch-all. There's a lot of studies on the Myers cocktail that are out that we're privy to. That said it's pretty safe therapy for numerous different ailments. Some people may have chronic pain syndrome, many things, and it works well for that as well.
Okay.
Myers cocktail. Then we have what we call the hangover cocktail. This is for someone who have to go to work the next day, or have to go to work on Monday, and they party all weekend. And now Sunday is here, and they want to make sure that they're well hydrated with the right nutrients. Thiamine, vitamin B12, vitamin C, vitamin E. They'll come in, and then we'll just give them an IV infusion, folic acid, and just give them a nice boost so that they can the hangover will be short-lived, and they can go on to their next day. Other person who may be a marathon runner, they may come in and just like a simple lactated ringer IV with some vitamins in it, folic acid, thiamine, B12, and then they're fine. There's some people who may not need any nutrients in it, just to get a boost, just get some hydration in, because they find that they may be having like low urinary output, which means that their volume of pee urination is limited, or is low, or is too cloudy. So just to kind of just clean them out and just get them a jump start. We also have something that's called like a lifesaver, and that's just mixed with just IV fluid with some electrolytes. And again, it's kind of like just to kind of give you that boost of energy that you may need.
Okay.
We also have IV therapy that's called Inner Beauty. So that is also for people who are looking for complexion, acne. So we call it Inner Beauty. And then what this does is it's kind of like just help you, give you that jump start in your skincare. You still have to get your facials and take care of your skin, but it's just kind of like you that enhancement. Many patients also like glutathione. They love this medication because this also does well with pigmentation, and also it also brightens your skin. So there are a lot of people who are concerned about how, you know, their complexion, they may be too dark, or it doesn't really matter what their concerns are, but we know that it's going to help with their complexion to help brighten your complexion. And this medication is done repetitively, so it's not you just come in once and you just get it. So people get it every week, you know, once a month. So it's a continuation of therapy to see the effect of this medication.
Okay. Could I guess we could combine it with, you know, the facials like you mentioned earlier.
Exactly.
Okay.
Exactly. And you had mentioned before, this can be an IV push. So this is like in and out, 5 minutes in and out.
Okay.
And we also have our B12 shots. So these are people who are trying to lose weight. So they may come in and they just want to like just you know, help with their weight loss, or people who just want some energy, they get a B12 shot. So B12, there are many foods that carry B12, but we all know in medicine that B12 is better absorbed when it's go into the bloodstream, or they do an IM injection where they go into the GI tract, which is when you eat, and allow it to digest in the body. It doesn't work the same way as getting the IM injection or getting it infused. So that only lasts for about a week. So most patients, they'll come in every week and get a B12 shot.
Okay.
And as you mentioned before, it can be combined with other IV therapy and any other treatments that you get here in BMA.
Okay. And it's safe to get it as often as we would want to, or every week?
No, it's every week. So you can't, I would not accept anyone coming in 3 times a week to get B12 injection. So it's once a week, once a month. Those are my recommendations for that type of infusion or injection.
All right. I mean, it's pretty impressive how versatile IV therapy can be. You know, are there any other IV therapy treatments that we should know about?
Well, I mentioned a couple of them. Inner Beauty. I mentioned
Myers
the
cocktail,
the thiamine injection for people who may drink a lot. So they may lose their vitamins, which is thiamine is a vitamin. The folic acid. So these are medications that are used to help those type of patients who may have problems with alcohol and drinking.
Okay.
And of course, there's always vitamin C. Vitamin C is going to boost your immune system. So you can also get a vitamin C infusion as well.
Okay. So other than, you know, what you mentioned earlier about a person being completely transparent with their medical history before getting IV therapy, is there any other tips for someone considering IV therapy for the very first time?
So if you're getting IV therapy for the first time, the most important thing is to pretty much know what your ailment is. What is bothering you? What is it that you're trying to accomplish? So if you come in and you're like, I don't know what's bothering me, I just want IV therapy, you can just get IV infusion. You can just get regular lactated ringer or normal saline with nothing in it. Okay, so it's not that you have to come in and say, oh, you know, I don't know what I want. Should I get vitamin C? Should I get thiamine? Should I get folic acid? So if you don't really know what you want, but you just feel like you just don't have enough energy, you can get a B12 shot or just get normal saline with nothing in it, just an infusion. So you don't have to have all these nutrients in it. The concept of IV infusion is to bring the nutrient that you can absorb in your food. So the whole goal is that you really should kind of like have an idea what it is that's bothering you, so that way we can best treat you. But if you don't know, we can build on it. We can give you saline, have you come back in 1 to 2 weeks. How do you feel? I still feel this. Another person may trust you. So sometimes when they first meet you for the first time, everyone is not going to be this comfortable to say, oh, give me a Maris cocktail or give me this. Sometimes they want to gain your trust. So sometimes you don't have to always give, medication to a patient. You can just do a consultation, talk to them, and hydrate them.
Okay. Yeah, that makes sense. Before we move forward, though, does anyone in the viewer section have any questions? Has any of the IV therapies piqued your interest? Even if you're needles, Dr. Stevenson did mention that it's a very small needle that would be inserted, right? A very tiny thing. So I doubt you'd feel anything.
Well, you may feel something, but if you don't like needles, I can numb your skin before I put the IV therapy in, because some patients don't really like to be stuck. So yes. So if they're afraid, everything anytime you pierce someone's skin, there's an ouch. And there could even be like people can pass out. That's why I always say to you, your vital signs before, so that I can know what their baseline is before and after. That's very common. You see people who are afraid of IV therapy, and they may pass out.
Yeah, we have
I see
from Alaric.
Yeah, so we are located at 290 South Livingston Avenue in Livingston, New Jersey, 07039, and our phone number is 862-223-8449. So you're welcome, and I would love to have you come in. I get excited when I see people joining me in live, and then they're like asking questions, and then they want to have contact with me and also get to meet me and just talk, and this is a journey. So it's about you being comfortable with your provider. There's many of us out there in the field, and we're all friends. So don't be afraid if you come in and you went to somebody else. It doesn't matter. We're all in the same community. We all know each other to some extent, and we're here to take care of patients.
Right.
So don't be afraid, and don't think that you can't come to me because your friend may be mad. We all like each other. So we're competitive, but we all like each other. So.
Okay, so you're always welcome to be a part of DNA family or any other family out there, like Dr. Stevenson said. Based on the information that you provided earlier, though, it kind of piqued my interest. What if I'm someone that doesn't like taking vitamins on a regular basis? Could I use IV therapy to kind of replace having to do that?
Yes, you can, because I don't like to take vitamins. I forget every day. So that's some of the reasons why we don't get enough nutrients, is because sometimes it's a lot of vitamins to take, and people don't like to swallow medication. So just coming and get the IV therapy is also beneficial. So yes, you can. If you don't want to take vitamins, you can get the IV infusion as well. So that would kind of supplement it. And also too, as I explained to you, that there's some people whose diet doesn't give them enough nutrients. So the IV therapy helps enhance that. It helps kind of support and help and build your overall wellness.
Okay, so what if I am a client that I'm already on vitamins, per se, and I believe that I have a balanced diet and all, but I still feel a bit lousy? Is it still safe to take the IV therapy?
So what I do sometimes when the patient is not sure, I don't really want anyone to be like, their vitamin levels are too high. So I just do a blood test. So as I explained to you, we can do blood tests, and then we can see what it is that they need based on their blood tests. So the first visit you come in, if you get an infusion and your levels are high, it's not going to harm you. So you can still get the infusion. We draw the blood, send the labs out, and then we'll come back, and then we'll
determine which one is best. Alaric had a question. He says, I know someone who will probably be interested, so I will definitely let them know about you guys. Thank you so much for that, Alaric.
Thank you.
Appreciate it. And feel free to reach out to us via DMs or send us an email at the email. What's the email again, Dr. Stevenson?
Info at BlueMirageAesthetics.com, which is BLEUMIRAGE Aesthetics, AESTHETICS.com.
Yes. Okay. And I'm guessing with summer just around the corner, this hangover IV therapy would come in pretty handy for those that like to party and stuff, you know, to alleviate the symptoms of the hangover and stuff. But yes, that was quite a bit of information. Is there anything else that you would want to squeeze in there for us, or would that be
all? As I had mentioned to you, that we are a community of medical practitioners, nurse practitioners, nurses, doctors, and we support each other. So I do have a colleague also who does IV therapy. Her name is Dr. Patricia Elasian. So if you're in her area, you can also reach out to her. We went to school together. We work together. We are friends. We mingle. So I have no problem supporting my colleagues.
Right.
So if anybody is in her area, you know, just call me. I have her business cards and her flyers in my office. You can also reach out to me, and I will just get them to you. You can just give us a call.
Right.
Okay. So, like I said, I have a lot of colleagues in the aesthetic medical spa business, and other specialty that kind of like helped me as I was coming up in my field. That if I needed a question, if I needed a favor, if I didn't know something, if I wanted to learn something, they opened their doors to me. So that I'm very grateful of. So with me, I just want to be also respectful to all of my colleagues who are in the medical aesthetic profession, because we're all one big family in reality.
That's true. Yeah. Okay. So, you know, first and foremost, like Dr. Stevenson mentioned earlier, it's good to be transparent with your healthcare provider. Even if you're not coming to BMA, right? Do your research and choose a reputable provider with qualified healthcare professionals, and be sure to communicate your health goals and any medical conditions or allergies that you may have. And finally, stay hydrated and nourished before and after your IV therapy session to maximize its benefits. Greetings. Thanks for joining our live.
Yes.
We were discussing IV therapy. Yes.
Yes. So we're not going to rush through because we still have time. So there's people that are still joining. So what the most important thing when you're going to do anything that's involved putting anything in your body is do your research and know your providers. Make sure that the person is a reputable professional that's not going to cause any harm to you. Like I said, I have a lot of colleagues that are in this business, and our goal is to make sure that all of our patients, anyone that comes into our care, that we're providing with safe and FDA approved products, and that we're not going to do anything to harm you. So please, please, please do your research, because I really don't want someone to go to someone and got metal or something bad happened to them. Now they come to me, and now, you know, I'm trying to fix issue. I'm not a fixer. So I really want you to do your research and make sure that you know who your providers are and know what's being put into your body.
Yeah.
So do your research. And also, too, just to let you know, because we are a med spa, when you come in, we take a lot of pictures. So don't be alarmed if we're taking photos. This is how we protect you as our client, and this is how we protect ourselves. Okay? So you don't ever want to come into our practice and something happens and then we have no documentation that something happened to you. So we take a lot of photos. So don't be alarmed. It doesn't go anywhere. None of clients' photos get posted on social media without their consent. So you don't have to be concerned about why I might be videotaped. Where is it going? It's going nowhere. It's just in our files, just for you. And then it goes into your chart as well. And that's it. It doesn't go anywhere.
And you guys are always notified about her doing so beforehand. So, you know, you are aware of what is happening, what is taking place. All right?
Correct.
So for those that are coming in, we're just going to go over, you know, the list of IV therapies out there that we just discussed. But
before you continue, I want to give a shout out to my injectable beauty who just joined us. I will be
Welcome.
coming to you. I've been following you as well, and I'm definitely going to be taking your Botox classes. I am just trying to like make sure that my home base is is covered. So once my home base is covered, I love what you do. I watch you all the time, and I will be coming to you for Botox. Okay? So thank you for joining.
Welcome. And guys, please, next time when you're coming to our lives, remember it's every Wednesday at 8:30. Please bring a friend. We welcome you all. Right? Okay, so we discussed, Dr. Stevenson, I'm gonna need your help with this one. We discussed the Myers cocktail, the lifesaver. What are the additional ones?
So we mentioned the lifesaver. We mentioned inner beauty. We have mentioned the glutathione. We mentioned the hangover cocktail. We mentioned B12 injection, ascorbic acid, which is vitamin C, and B12. So there's such a vast field of IV therapy out there. And as I said, it's based on what the patient is trying to accomplish. But like I said, don't be ashamed or don't be afraid if you don't really know what you want. You know, we'll work together. We'll get there. So you don't have to come in and say, oh, I need a Myers cocktail. I don't know if I really need that, but I think that I need it. You know, we'll work together. So there's nothing for you to be, not know or to feel embarrassed that you don't know. This is a process that we work together.
Right. And this live session can serve as a reference for information. So persons like Alaric that says he knows someone who probably interested in getting this service, you can always feel free to share this live with them because it will be on our page here on Blue Mirage Aesthetics IG page.
Yes.
Yeah. Okay.
So if anyone else is joining, I thank all of you. I even saw Dr. Jason online. Dr. Jason, I've also followed you, and I've also will definitely be getting in contact with you. I saw that you started your own skincare line. Kudos for you, and thank you for coming and joining and watching BMA. As I said, we are a small family, and we all just need to kind of like, get into our little group and support each other. We're all going to be learning from each other. There's something that you may have that I may want. And there's something that I may have that you may see that you may want. So it's open ball game and fairness. So I'm open. I'm willing to learn from you, and I probably will be reaching out to you as well because I've been following you and watching your amazing work that you do.
Alrighty. So I guess that's it for today on IV therapy, Dr. Stevenson. So thank you so much for sharing your expertise with us today. And thank you to our viewers for tuning in on our episode 4 of Beyond Beauty with Blue Mirage Aesthetics. And remember, if you have any further questions about IV therapy or any other service that you may see us offering, please don't hesitate to reach out to us via our DMs. Shoot us an email at info@bluemirageaesthetics.com or give us a call. The number's here on our Instagram page in our bio. And even visit our website at www.bluemirageaesthetics.com. And until next time, take care and stay healthy.
Thank you, and have a good night, everybody. Thank you.
Bye. Thanks for joining.
Thank you for all of my followers, and thank you for all of my professionals who are joining me. I appreciate you. Have a great night.
Right. And see you guys next week.
Okay, bye-bye.